This shows how the MINT 43s with the MINT EZ's procedure is performed. First, you'll need to part and braid the hair, preferably at a 45-degree angle above the ear and in front of it. And then you mark the 2 spots where you're going to enter, and then 3 spots lateral to the nasolabial folds, and 3 above the jowls where you're going to exit with the thread. Patients will still likely need some filler both in the temples and up above. It'll take 3 boxes typically of the MINT 43s and 1 box for the neck. First, you numb with about 40 cc's of 0.5% lidocaine with epinephrine, 1 to 200,000. You can use 30 gauge for the entrances and exits, and then you come from above and below with the 25 gauge 1.5 inch needle, and you place it in the deep sub-Q, and you do the same thing in the neck. This minimizes bruising. Then you put on a head drape. You then make a 1.5 millimeter punch, and then you put this curved needle passer. You put the 3 threads through there, and then you use this blunt passer. You go in deep when you're in the face part, and then you allow the sharp cannula to come out the skin. You're repeating this basically 3 times for the jowls, another 3 times for the nasolabial folds. To get it to go through the skin, you pull back on the blunt passer and use a little instrument to hold the skin still, such as the side of a pickups. And then you pull 2 threads at a time while you use your palms to push the skin and fat up. You cut off the exits. You should only see dimples at the exits, and they're easily released. You repeat the same process on the other side. First you put in the passer, then you put 3 threads through this, and then you pull the passer back through. It takes the threads with it, and then you put the blunt passer, which has the sharp passer alongside of it, and it becomes sharp just by pulling back on the blunt passer. You go from superficial, then you go deep only when you're in the mid-face. And in the neck, you make 2, I like 2 millimeter punches because it's hard not to catch the dermis with these needles. You go straight in at first to try not to catch the dermis, and you just go just beneath the skin above the muscle, and you exit below the ear. You cut off the needle, and immediately after you give some Celebrex and Tylenol coating.